Hello everyone! Breastfeeding can be an adventurous journey. It's a journey made up of downhills and uphills, but not because of that it needs to be traumatic or painful. The way to make it right from the start is to get your baby to have a deep latch. So let's go in this video where I share some tips in order to achieve one for you and your breastfeeding journey. Let's start! Hello future parents! Breastfeeding is such an important part of your motherhood journey, and not because you're pregnant, you just need to focus on the birth and the labor experience, but you also need to prepare for the breastfeeding journey. My name is Ilenia, I'm a midwife. I have been helping women during their pregnancy, birth and postpartum journey for over 7 years now. Therefore, if you're new to the channel and you like this type of content, don't forget to subscribe. Who needs this video? Everyone, whether if you are pregnant right now or if you have your baby in your arms and you're trying to figure out breastfeeding, you'll find so many useful tips in order to get your baby to latch properly. It's also important to say that not all babies latch wrong. Actually, the majority of them will get it in a few hours or days, in a few tries, and they will get it good. How do you know if your baby is latched properly, for example? Well, first of all, there is no pain. There can be discomfort, especially in the first days, but breastfeeding should not be painful. Another way to check it is that your breast feels nice and soft after the feed. They might feel a little bit like full and kind of engorged, especially at the beginning, but then after the baby has been latched for 20, 30, 40 minutes, they feel nice and empty again. Another way that you can use to check that your latch is correct is by looking at baby output, by the number of wheeze and poos that they do, and also by checking their weight when appropriate, not too much. And if they're gaining enough weight, then the latch is correct and your breastfeeding journey is going smooth enough. Some babies do require more support. And that's where your preparation comes into place, because if you read about it, if you prepare yourself for the breastfeeding, you will know how to identify those problems before they even become problems. So let's see how we can get baby to latch properly. First of all, babies in the first days, they're going to be very tired from the birth and they might sleep a lot, but they will have those wake windows that you need to take advantage from, and you need to feed them in these windows. Usually they're like 45 up to 60 minutes long in the first days. You want to start to prepare for the feed when your baby starts to wake up. So not when they're crying and they're desperate, but when they start to be in the quiet alert phase. You'll see them looking around, putting their hands in their mouth, maybe sticking out their tongue. Those are all early feeding cues, and you want to make sure that you attend to the baby when they're nice and quiet. Why? If they're frustrated, you won't get anywhere, you'll get frustrated and it will be all a mess. So what do you do when baby starts to wake up? Don't pick them up immediately. You get comfortable first. Prepare your breastfeeding location. Get yourself as many pillows as you can find, water close by, something to read if the feed is gonna go long, it's gonna take a lot of time. And then get the baby or get someone to get the baby for you, and you can start to position your baby. Position is so important in order to have a correct latch. Once you position baby in the right way, you won't need to do much in order to let them have a proper and deep latch. There are two types of latch that I'm referring to this video: a deep latch, which is the correct latch, and then a shallow latch, which is a latch that we refer of being like superficial and just not deep enough. You picked up your baby, maybe they're still very sleepy and they don't want to feed. That's another great tip that I have for you. Strip them down, change their nappy, and put them skin to skin. Skin to skin will activate the reflex and their instinct to feed, and will let them root to the breast. It's not mandatory. You can do it any feed. Absolutely yes. Skin to skin is great for thermoregulation, for bonding, for oxytocin flow, for everything. Like any problem, skin to skin can sort it and solve it. But if your baby is nice and awake and is already starting like to show you feeding cues, then you can just put him to the breast. Now, what do? You support the baby on your arm, whichever position you decide to. I'm showing you the cross cradle position, but the same in the rugby hold, or in the laid back, or in the sideline position. The most important thing is that baby is nice and tucked close to your tummy, and their tummy needs to be close to your tummy. You don't want baby to turn their head to find their nipple. They need to be already in line. Ears, shoulders and hips need to be in line. So nice and tucked close to you and in line. Once you've done that, you want to support their neck. Make sure that you don't push their head close to the breast. First of all, never bring the breast close to the baby, but always bring the baby close to the breast. But in order to do that, don't push their head against it. Why? They need to be able to pull back and to adjust themselves in order to get a deep and correct latch, and they won't be able to do so if you're pushing their head. So what do? Like, it's normal not to be able to handle baby daily if it's your first baby and you never care for, like, after newborn. That's absolutely fine. Don't worry, just take some practice, but you will get there. Place a C-shape hand around their neck, and you'll be able to support them. They're not going to be very heavy, and you will have a good hold in this way. Once you got this nice and close position, you want to make sure that their hands are not in the way. A lot of parents are very worried about the hands because babies tend to get them in their mouths when they feed. First of all, it's normal. It's a reflex that they have. The smell of the hand, it reminds them the amniotic fluid, the colostrum, and it's a way that they have to orientate themselves. So I personally don't like putting mittens around them. It's like blindfolding eyes of someone, like from pregnant to see. Like they do see and experience the world through the sense of touch at the beginning. So it's very important to let them do that. But don't be afraid of repositioning the baby. So make sure that the arm is around your breast here, and the upper arm is on your breast, and you'll see them using their hands to actually stimulate the breast and get a comfortable position. So absolutely fine. Once you're in this situation, I was saying, you want to make sure that the nose is pointing the nipple and not their mouth. This is the number one tip that I have for this video: nose to nipple. We wrongly think that babies latch in this way. Instead, baby will anchor their chins in the areolas, lower part. The areola is this brown part, and then open their mouth in this way. They don't do it nice and evenly like that. They anchor their chins and they open their mouths in this way. This is because it will allow them to grab a good bite of the breast, a good portion of the breast tissues. It's very important to know that the nipple is just the door of the breast, but the milk production is made in the gland, in the breast tissues, and by getting your baby to have a deep latch and get a good chunk of the breast, you will get the right stimulation. Your nipple will not get sore because it will go not in the hard palate, which is the first part of the palate, but it will go into the soft palate in the back, and baby will be able to stimulate and drain and suck at the breast properly, so that you'll get more milk the day after. Also check that both lips are out, and if you see that usually the bottom lip is the one that is a bit tricky, you can actually gently push it and make it go out. But if you follow all the steps for to achieve a deep latch, you shouldn't need to correct the lips and they should be fine, but it's also something to check as well. If your baby is getting the latch correctly and then suddenly your milk comes in and then the breast feels very full and engorged, and you see that they're struggling to latch and to achieve that suction and that vacuum that they need in order to stay on the breast for long, babies during the feed will stop to suck. They won't suck constantly, but they will be staying at the breast. I was saying, if they're not able to do so because the breast is very engorged or the milk is coming in like heavily, what you can do also is massaging the breast under the shower or manually with a hot compress and drain a bit of the milk out. Sometimes you even need to use a pumping machine in order to do that if you have a high milk supply, but those are all base-to-base cases that a lactation consultant or a midwife needs to evaluate with you. So make sure that not just because your milk is coming in, you don't latch the baby as often. Is even more important in those situations to latch the baby as much as possible so that your breast can understand how to calibrate and how much milk baby needs for the future weeks and months to come. How do you know that the latch is incorrect? Well, first of all, pain. Pain is the first alarm sign. I'm not talking about discomfort. There will be discomfort, unfortunately, with breastfeeding at the beginning. You might feel like pinching sensation for the first few seconds, sometimes even a minute or two when the feed starts. That's fine. It should get better though. Towards the feed, you should not feel that pain, that discomfort anymore. If it's constantly painful and very unbearable, obviously it means there is something wrong. So another way that you can check is actually by checking the shape of the nipple, the way your nipple comes out after the baby latches. And if you see that kind of typical lipstick shape, usually means that baby is not getting the nipple deep enough into the soft palate, so something to check. Also, the color can tell a lot. If a nipple goes in nice and perfused and pink and it comes out white and squished, usually means the latch was not properly done. If you hear a clicky sound, usually it's a sign that the latch is incorrect. I'm not talking about swallowing sounds, that's fine, but if the baby does this type of like while they suck, usually means there is something going on that needs to be looked at. Sometimes they correct themselves and they're able to interrupt that sound, but if they keep doing it and they do it constantly every feed, do seek for some help and some specialist advice. It's important to say that not all the breasts are the same shape and size. Not all the babies are the same. Some women might have flat or inverted nipple or large size breast, or some babies might have tongue tie or something else interfering with the breastfeeding. So in those situations in particular, you need even extra help. So don't be afraid to ask, and do invest in some breastfeeding support because it will pay you off a lot for the short-term and long-term breastfeeding journey. If you're watching this video thinking, oh my god, there are so many things to do and to know, don't worry, you'll get there. It's not as hard as you might think it is. It's like riding a bicycle or driving a car. It's hard at the beginning, but then you'll get it, and you don't need to go through all the steps every time that you get into the car or you take your bicycle to go for a spin. Same for breastfeeding. Once you get the first feed right, then the journey will be so much easier. It's a beautiful experience and you'll be thankful that you gave it a try. If it doesn't work, it doesn't work, but at least you gave it a try and you did your best. It's all for this video. I hope that it was helpful. If you've not done so already, please make sure to subscribe to the channel, and I'll see you next video. Bye bye!